back. The CDC today with an urgent pandemic warning for pregnant women. Get vaccinated. The health alert coming after they say 22 pregnant women died of COVID just last month, the most in 1 month since the pandemic began. The agency also saying compared to other COVID patients, pregnant women are twice as likely to need intensive care and 70% more likely to die. The other alarming numbers, right now only 31% of all pregnant women are vaccinated and just under 16% of pregnant Black women. With us now is Dr. Sujatha Reddy. She's a board-certified OBGYN for Premier Care for Women in Atlanta. Doctor, thanks for being with us. It is staggering how many pregnant women aren't vaccinated, and then there's the racial disparities that's also very concerning. Why do you think this is happening?
Yeah, nice to be with you, Anna. I think it's happening because there's obviously a concern with pregnant women for their child. And, we're seeing people be fearful of this vaccine when they're not pregnant. When you're pregnant, obviously your main concern is your child. And so it kind of makes sense that there was some hesitancy early on. We have now vaccinated hundreds of thousands of women, tens of thousands who became pregnant, and it's crystal clear that the benefit of the vaccine outweighs any potential risk. So you may have been fearful 6 months ago, but by now we've seen this vaccine is very safe.
So do you feel that OBs overall are in support of their patients getting COVID vaccines, or are you concerned that the reason the numbers are so low is that the right information is just not getting to these women or even to their doctors?
That's a great question. I think as OBGYNs, we've been recommending this vaccine because the CDC has recommended to pregnant women, the American Congress of Obstetricians, Gynecologists, Society of Maternal Fetal Medicine Specialists, which are the high-risk OBs, all are in agreement that pregnant women should get the COVID vaccine. So I think it's just a little bit of a time lag from that message getting across, people realizing that the vaccine has now been out and been delivered to thousands and thousands of pregnant women, and it does appear to be safe. I think we also need to tell women, just like you said, that pregnant women are at higher risk for severe complications, and they're at risk for complications with the pregnancy. Things like preterm labor has been seen for women who get COVID during pregnancy. So that message does need to get out there.
I mean, unfortunately, we've talked a lot about all these conspiracy theories that are out there and a lot of misinformation about COVID and the vaccines that have really perforated some of the, information avenues that exist. What are you hearing from hesitant patients? What are their biggest concerns?
Yeah, their biggest fear is that this vaccine may harm them or their unborn child. But, we've dealt with this in pregnancy. There's a lot of things that happen. Pregnant women are, difficult patients because you've got a mom and a baby, you have two patients. And pregnant women, they don't want to take anything that could potentially harm their child. So here we are in 2020, 2021, asking them to take a vaccine that's brand new. So I understand the hesitancy, especially early on, but I think by now we have given this vaccine to so many women that have gotten pregnant, women that delivered a baby, women who plan to get pregnant, and there's been no findings of any concern. So, we had the same problem when we recommended the flu vaccine to pregnant women, but we've done a good job of that. We're going to keep encouraging pregnant women to get this because no baby should grow up without their mom.
And I think it is so important for our viewers to also know that not only is there no harm from this vaccine to pregnant women and their unborn children, but there's actually helpfulness by this vaccine, and there's added protection for the baby after birth, as we've just learned from some recent research that came out showing that babies have the antibodies from the vaccine after they're born. So there's even more of a reason to get vaccinated to help your child. Dr. Reddy, thank you so much for offering us your expertise and sharing your words of wisdom with our viewers as well. Really appreciate it.
Thank you.